go soon too. It's already running.
When giving IM injections, such as vaccinations, what you want to do is you want to make a triangle like this, and you want to aim for the center. So Brandy doesn't need any injections right now, but again, you want to make a triangle and aim for the center. You go straight in, you got to be quick, you can't hesitate, pull back a little bit to make sure you're in a good spot, and then inject. And if you're giving a sub-Q injection, you can do it in the same way, but obviously you want to make a little bit of a tent, put your needle in, aspirate a little bit, and then inject. So obtaining a TPR on a horse is just like with any other animal. Obviously you just want to always make sure the animal is aware that you're there. So normal temperature on a horse is about 99 to 101. Pulse should be between 28 and 44, and then the respirations shouldn't be any greater than 28 to 30. So we'll start by feeling Brandy's digital pulses, which in normal horses should be pretty hard to find, so we may not be able to feel them real well. Obviously, if you feel bounding digital pulses, then there's a problem. We may be dealing with something like laminitis. But where you feel very, very faint, or use your two fingers, you can sometimes feel it down here. Again, very, very faint. Sculpting her chest. Obviously a horse's chest is pretty big, so you want to make sure you listen to everywhere. We need to do the same thing on the other side. And then with horses, you always want to listen to their gut sounds as well. You want to hear gurgling, burping, gassy sounds, so that would be normal. Okay, so normal sounds there. And then you always want to look at their mucous membrane. Make sure they're nice and pink with a capillary refill time of less than 2. And then if their gums are nice and moist, that's a good indication that they're pretty well hydrated. So Brandy's gums are light pink, which is pretty normal. Nice CRT, and her gums are nice and moist. And then lastly, when you're going to take a horse's temperature, obviously it's best to keep your hand on them the whole way back to their rear. Some horses are going to behave better than others. Lightly pull their tail to the side. Insert the thermometer. Alright, and Brandy's temperature is normal at 100.2. part of the TPR that I forgot to mention is the best place to feel a horse's pulse to count their actual pulse rate is right on the side of their mandible here. And remember, you're going to have to use super light pressure. If you feel too hard, you're not going to, or if you press too hard, you're not going to feel it. And you've got to keep your hand still, you know, in the same place since their heart rate is so slow. I mean, you've got to give it time to actually beat. So this is the best place to really feel the pulse on a horse. So Brandy does not currently need any oral medications or dewormer, but if she did, you would obviously want to have somewhat of control of their head, and you always want to try to go back to the back of their mouth. If you shoot it right in the front, she's going to spit it out and not really swallow it. So this is Banamine we're not going to give her, but most dosing syringes for horses have like a long tip on the end that you're able to insert it back farther in their mouth.